Assalamualaikum and a pleasant day to each and everyone. My name is Matanog Bai Hamida A. In this video presentation, I will be discussing about Huntington's disease. So first, for us to better understand what exactly Huntington's disease is, let us try to operationalize the term Huntington's disease. So, let's start. Huntington's disease is an inherited disease that causes the progressive breakdown degeneration of nerve cells in the brain. Huntington's disease has a broad impact on a person's ability such as movement, thinking, cognitive, most especially depression and psychiatric disorder. So ano nga ba ang HD or Huntington's disease? Ang HD or Huntington's disease ay isa itong inherited disease from your parents, especially kung yung mga magulang mo may past history sila about this disease. Later on, pag-uusapan natin yung mga symptoms and causes ng Huntington's disease. This disease destroys brain cells leading to the rapid degeneration of brain tissue. Ito ang tanong. Can we prevent this Huntington's disease? No, because HD is caused by having a mutation on the gene. You can't change your gene or prevent this from developing. Yung mga taong may nasa risky situation ay ito yung mga taong meron ang kanilang mga magulang. Kumbaga may past history na ang mga magulang nila about this disease. Maaari nila yung mamana sa kanilang mga magulang. Yun yung pinaka-risky situation if isa sa pamilya yung may ganito. Proceeds sa symptoms of Huntington's disease. Huntington's disease usually causes number 1, movement disorder, number 2, cognitive disorder, number 3, psychiatric disorder. So ito yung mga symptoms ng Huntington's disease. Isa-isahin natin silang alamin kung ano bang nakapaloob sa movement, cognitive, and psychiatric disorder. Sa movement disorders naman, the movement disorders associated with Huntington's disease can include involuntary movements and impairments in voluntary movements. First, involuntary jerking or writing movements or chorea. Muscle problems such as rigidity or muscle contracture. Sunod, slow or abnormal eye movements. Kumbaga yung takbo ng eyes mo nagiging abnormal, hindi siya normally na mata, or sabihin na natin na if you have this disease, ito yung mga symptoms niya. Isa sa mga symptoms niya. Next is impaired gait, posture and balance, difficulty with physical production of speech and swallowing. Yes, isa ito sa mga symptoms when you have Huntington's disease. Nahihirapan kang magsalita, nahihirapan kang igalaw yung ibang parte ng katawan mo. It depends no sa anong klaseng Huntington's disease ang makakapekto sa katawan mo. So, cognitive disorders. Cognitive impairments often associated with Huntington's disease include first, difficulty organizing, prioritizing, or focusing on tasks. Okay, so nahihirapan kang mag-focus sa mga bagay-bagay, nahihirapan kang i-prioritize yung mga dapat mong i-prioritize. Lack of flexibility or the tendency to get stuck on thoughts, behavior, or action. Yes, most commonly if you have Huntington's disease, naaapektuhan ka, nagkakaroon ka minsan ng depression. Lack of impulse control that can result in outbursts, lack of awareness of one's behavior and abilities, slowness in processing thoughts or finding words. Ito talaga yung cognitive mo na aapektuhan. Yun nga yung sabi ko kanina, most commonly depression, difficulty in learning new information. So ito yung nakapaloob sa cognitive disorders. So lastly, psychiatric disorders. The most common psychiatric disorders associated with Huntington's disease is depression. Yun nga yung sinabi ko, most commonly depression. This isn't simply reaction to receiving a diagnosis of Huntington's disease. Instead, depression appears to occur because of injury to the brain. and subsequent changes in brain function. Signs and symptoms may include first, feelings of irritability, sadness, or apathy. Okay. So, madalas kang mairita, tapos madalas mo rin maramdaman yung kalungkutan or sadness. Social withdrawal, fatigue, and loss of energy and insomnia. Frequent thoughts of death, dying, or suicide. So, yun yung nakapaloob sa psychiatric disorders. Dito kasi sa symptoms, most commonly yung depression. Nakakaramdam ka ng depression kapag meron kang nitong Huntington's disease. Causes of Huntington's disease. Huntington's disease is caused by an inherited defect in a single gene. Huntington's disease is an autosomal dominant disorder. Ibig sabihin that a person need only one copy of defective gene to develop these disorders. So, let's proceed sa treatment. Actually, there is no treatment can alter the course of Huntington's disease. Pero may mga medication na can lessen some symptoms and movement and psychiatric disorder. May mga medication na maaring makatulong sa Huntington's disease. So, una is psychotherapy. A psychotherapist is a psychiatric psychologist or clinical social worker can provide talk therapy. Ito na yung ika-counsel niya yung pasyente niya. Parang talk therapy, parang a conversation. Developing coping strategies, manage expectation during progression of the disease, and facilitate effective communication among family members. So, ang next naman is physical therapy. A physical therapist can teach you an appropriate and safe exercises that enhance strength, flexibility, coordination. These exercises can help maintain mobility as long as possibly and may reduce the risk of falls rather. So, this physical therapist, kumaga ito yung nagsisilbing coach mo pagdating sa exercises. This may enhance your strength, yung flexibility mo physically. So, lastly, occupational therapy. An occupational therapist can assist the patient with Huntington's disease, family members, and caregivers on the use of assistive devices that improve functional abilities. These strategies may include abilities, first, handrails at home. Second, assistive devices for activities such as bathing, pagliligo, and dressing. Third, eating and drinking utensils adapted for people with limited motor skills. So, yun yung nakapaloob sa occupational therapy. Tandaan, there is no treatment pagdating sa Huntington's disease. Pero may mga medication na maaaring makatulong no sa symptoms, malasan yung symptoms na nararanasan ng isang pasyente kapag nagkaroon siya ng Huntington's disease. Diagnosis of Huntington's disease. A preliminary diagnosis of Huntington's disease is based primarily in your answers to questions. A general physical exam, a review of your family medical history, and neurological and psychiatric examinations. So, sa neurological examination, the neurologist will ask you a questions and conduct relatively simple tests of your motor symptoms such as reflexes, muscles, strength and balance, sensory symptoms including sense of touch, vision and hearing. Third is psychiatric symptoms such as mood and mental status. The neuropsychological testing naman is the neurologist may also perform a standardized test to check your memory, reasoning, mental agility, language skills, and also special reasoning. Yun yung mga basic sa neuropsychological testing. Psychiatric evaluation. Ito naman is you'll likely be referred to psychiatrist for an examination to look for a number of factors that could contribute to your diagnosis including emotional state. So, yung emotion mo, the patterns of behaviors, the quality of judgment, no? Yung coping skills mo din if magpapa-psychiatric evaluation ka. Ito yung one of the diagnosis as Huntington's disease, signs of disordered thinking, and lastly is the evidence of substance abuse. So, yun yung mga posibleng ipapagawa sa'yo ng psychiatric if that evaluation was stick to your situation. Sa predictive genetic test naman is a genetic test can be given if you don't have a family history of the disease or what we call Huntington's disease but don't have any symptoms. Yung nabanggit ko kanina, which is the movement disorder, the cognitive disorder, most commonly depression, and psychiatric disorder. The test can tell you when the disease will begin or what symptoms will appear first, no? Then some people may have the test because they find not knowing to be more stressful. Yun na nga, no, sa cognitive disorder mo, parang feeling mo depressed ka. Most commonly yung nararamdaman ng mga pasyente na nagkakaroon ng Huntington's disease is depression. Others may want to take the test before having a children kasi nga yun na nga namamana, gene to gene yan eh. If yung parents mo may past history sila about this gene, maaari mong mamana yun sa kanila. Risk may include problems with insurability or future employment and the stress of facing a fatal disease. So conclusion naman is Huntington's disease is a very distressing illness that can be defined according to its genetic basis, its diagnosis, symptoms, and treatment. Actually, wala pa talagang treatment sa Huntington's disease. Mostly, according sa pagsasaliksik ko, yung mga pasyente na nagkakaroon ng Huntington's disease, umaasa sila na may treatment or cure sa pagkakaroon ng sakit na ito, pero wala. There is no treatment in Huntington's disease. Pero may mga medication na can lessen some symptoms na nararamdaman ng isang pasyente ng Huntington's disease. So, usually kasi pag nagkakaroon ka ng Huntington's disease, parang hindi naman sa pero mostly sa karamihan sa mga pasyente, parang feeling nila wala silang pag-asa, which is totoo naman. Kasi according sa aking research, ang Huntington's disease ay nakakamatay, lalo na pag wala pa siyang treatment. Pero may symptoms nga, medication na nakakatulong para malesen yung hardness na nararamdaman ng isang pasyente. And people with a known family history of Huntington's disease are understandably concerned about whether they may pass the Huntington's gene on their children. Yes, isa yon sa mga concerns ng mga magulang na merong Huntington's disease. Nag-aalala sila kasi nasa risky situation if alam ng mga magulang na may Huntington's disease sila, kasi naiisip nila paano kung maipamana namin, mai-inherit ng anak namin itong sakit na to. They will also suffer from this disease. Hindi naman madali magkaroon ng disease na ito kasi actually nanood ako sa YouTube. Grabe pala, ang hirap pasanin nitong sakit na to kasi ang dami mong nararanasan, ang dami mong nararamdaman, kagaya nung sinabi ko na most commonly depression, na apektuhan talaga yung as in yung pagkatao mo, lalo na yung way of thinking mo, yung emosyon mo, parang ganon. So that's my conclusion, yung sinabi ko kanina na mas concerns yung mga parents natin sa magiging anak nila kasi they know how hard it is to have a Huntington's disease. So again, my name is Matanog Bai Hamida and this is my report entitled Huntington's disease. So thank you for watching.